Good morning, my dear students. Welcome to my YouTube channel. In today's class, we are going to discuss about the history taking. So, in this class, what are the things we are going to learn? It's what is history collection, what are the phases of health history, guidelines of history collection, what is the procedure for history collection, system-wise examination, and how to document the findings in the medical record. So coming to the introduction, as we all are nurses, we know history taking and examination are the key components of patient assessment. It helps the delivery of high quality care and giving healthcare practitioners a better understanding of patients' problems. So when a patient is coming to the hospital, the two most important things we have to do is the history collection and the physical examination. So why we have to do this? In order to provide a high quality care to the patient. Care priorities can be identified and the most appropriate interventions can be provided to the patient. So we have to prioritize the care for the patient, and according to the priority we have to provide the interventions. In order to identify such things, it is very important that we have to collect the history from the patient. It provides a complete picture of the person's past and the present health condition. Of course, it will give the information about the past and the present health condition of the patient. So what is the definition of the health history? So it is the systematic collection of subjective data which is stated with client and objective data which is observed by the nurse. So there are two types of data there, subjective data and objective data. Subjective data is the data or the information that is given by the patient or the client. Objective data is the data or the things that the nurse is observed and he is collecting. So what are the purposes of health history? Collect the subjective data, that is what the person says about himself or herself. Collect the objective data, what you observe through measurement, inspection and palpation. What is palpation? It is the examination of pressing on the surface of the body to feel the organs. Then percussion. Percussion is the method of tapping body parts with the fingers or hands or small instruments as part of a physical examination. And auscultation, it is by the stethoscope you are collecting the data. There are two phases of taking health history. One is the interview phase and the recording phase. So, what are the guidelines for taking nursing history? As a nurse, we have to certain guidelines we have to follow. First one is private. The patient, the history taking, it should be private, comfortable. The patient should be as well as the nurse should be comfortable, and they have to sit in a quiet environment. Allow the client to state their problems and expectations for the interview. The first prior importance is to the client, so we have to give time for the client to state their problems. Orient the client, the structure, purposes and expectations of the history. Why we are going to collect the history, what is the how you are organized the history collection, and what's the expectations of the patient, everything you have to inform to the client. Communicate and negotiate priorities with the client. So it's a two-way communication and you have to prioritize the client's needs. Listen more than talk. You should be a very good listener. What the patient is telling, you have to listen it properly. Observe non-verbal communications. Example, the patient's body language, the voice tone and the appearance, everything you have to observe. Review information about past health history before starting the interview. So about the past health history, it is very important you have to review the informations. clarify the client's doubts if he has. Avoid yes or no questions. When detailed information is desired, you have to ask open-ended questions. Why, yes, for example, why you came to the hospital today? So it's an open-ended question, so the patient can give the detailed information why he came to the hospital today. Write adequate notes for a recording. You have to take the notes for recording for further use. Record the nursing history soon after the interview. So next we are going for the skill for health history. In that we have to go for the assessment of appearance and the mental status. This is the implementation stage. You have to introduce self, verify the client name, IP or OP number, and age, address, everything you have to verify. Explain to the client what you are going to do, why it is necessary, and perform hand hygiene and observe appropriate infection control procedures. It is for all the procedures you are going to perform the hand hygiene and the infection control procedures. Provide for client privacy. And observe for signs of distress in posture or facial expression. You have to check whether the patient is in a comfortable position with the and the facial expression, whether he is having pain or whether he is sitting simply quietly normal, that all the things you have to observe. Observe the body build of the patient, whether he is obese, whether he is lean, you have to observe the body build of the patient. Observe client's posture and gait, standing, sitting and walking. What is gait? Gait means person's pattern of walking, and walking involves balance, coordination of muscles and everything you have to observe. Observe client's overall hygiene and the grooming, whether he is clean, neat, everything you have to check. Note body and the breath odor, smell. Note the client's affect or mood. Assess the appropriateness of client's responses, whether the patient is responding properly, and the mood of the patient you have to observe. Listen for the quantity of speech, that is amount and the pace. Quality, that is loudness with and the clarity. Both the things you have to check it. Listen for relevance and organization of thought. Whether the patient is speaking, it is relevant what you are asking, only the patient is answering and he is organizing it. Everything you have to check it. So coming to the components of health history, record the date and time of day of the interview and the hospital registration number. In the biographical data, about the patient, what are the things you have to collect? What the full name of the patient, age of the patient, address and telephone numbers, client's permanent contact of client, birth date and birthplace, sex, religion and race, marital status, occupation, what's the language and educational thing. All the things you have to collect. And when you are collecting the history, source of history, so from where you will get the history. Record who furnishes the information, person himself or herself, although the source may be a relative, friend or a caseworker. In some situations, the person itself, the patient itself can give you the information. In some situations, maybe his relative, friend or someone else can give you the information. So source of the history you have to mention it. Note any special circumstances. Example, interpreter. Sometimes the language barrier will be there. In such conditions there will be a need for an interpreter to translate. Name of the physician treating the patient and diagnosis of the patient. What's the diagnosis? It will be on the case history. You can write it. Second part, it is after the patient's information. The second thing is the chief complaint or reason for seeking the care. Describe the reasons for the visit. For example, sometimes the patient may tell you chest pain for 2 hours, there may be sore throat for 3 days now and getting worse, feeling dizzy after standing up, maybe swollen ankles for 2 weeks, fever and headache for 24 hours, like that. What is the reason for visiting the hospital? The patient will explain you. Third one, history of present illness. That is gathering information relevant to the chief complaint and any self-medical treatment. Chief complaint, what the complaints now the patient is having. Present illness must include 8 critical characteristics. If the patient is telling that he is having the pain, so what are the things you have to collect on the means? Location. Ask the person to point to the location. Example, where the pain it is. Exactly, jaw pain or chest pain. Is the pain is localized to the area or it is radiating. Radiating means whether it is extending to some other parts, whether it is a superficial pain or deep pain, you have to ask. Character or quality. Whether it is burning pain, whether sharp pain or dull, aching or throbbing or stabbing. What is burning pain? Sharp pain, dull means like aching pain. Dull discomfort occurs at a low level over a long period of time. That's the dull pain. Then sharp pain, when you feel a sudden intense spike of pain, sudden pain. Sharp pain may be also fit that describes cutting and shooting. And the stabbing pain, like sharp pain, stabbing pain occurs suddenly and intensely. Throbbing pain consists of recurring achy pains. Quantity or severity. Attempt to quantify the signs or symptoms such as if the patient is having profuse menstrual blood flow soaking 5 pads per hour. Quantify the symptoms of pain using the pain scale. How much quantity and the severity. Timing, which includes the onset, when it was started, duration, for how many hours the pain will be, and the frequency, whether it is moderate, oftenly came, whether it is sometimes or always, you have to ask. And the pain setting, where was the person or what was the person doing when the symptoms started. If the pain started means at which settings the patient started the pain. Sometimes he may be sitting or he may be sleeping or he may be doing some activities. Settings you have to ask. Aggravating or relieving factors. That means what makes the person pain worse. Example, the activity or the weather, maybe food, after the medication, time of the day, maybe on the morning, night, like the weight. What is the aggravating or relieving factors you have to ask? What relieves it? Example, for sometimes after rest, the pain will be reduced. After taking medication, I'm okay. Or applying the ice pack, is it okay for me? Like that, what relieves the thing, you have to ask it. Associated factors, which is the primary symptoms associated with any others, that is urinary frequency and burning associated with fever and chills. The patient is having urinary frequency and burning pain, and after that associated with fever and chills also started. Pain perception, ask the patient how it affects the daily activities. Next one is the past health history. Why you have to assess the past health history? The purpose to identify all major past health problems of the client. This includes childhood illness, that is history of rheumatic fever, measles and mumps. What is rheumatic fever? It is a disease that can affect the heart, joints, brain and the skin. Measles, it is also an infectious viral disease causing fever and rashes upon the childhood. Mumps is also a viral infection affecting the saliva producing salivary glands that are located near to your ears. History of accidents and disabling injuries. So any past history of fracture or any head injuries, history of hospitalization, time of admission, when he was last admitted in the hospital, date, admitting complaint, when discharged, diagnosis and follow up, everything you have to write it. History of operations, where and why the operation has been done. What's the problem? You have to ask it. History of any allergies on the medications or food or something. You're having any allergies. And if the patient is a female, you have to ask for the obstetric history, that is maybe number of pregnancies, number of deliveries, number of preterm, before term, the baby term, that is preterm, number of abortion, number of children living, you have to collect it. In the immunization history, note the date and time for last tetanus immunization and tuberculosis skin test and other vaccine. What are the vaccination the patient got it, everything you have to write. Serious or chronic illness, asthma or any depression. Asthma, you know, it is a breathing difficulty. Depression, it is a psychiatric problem. Maybe sometimes the patient may have diabetes, hypertension, cancer or any convulsions or seizure disorders. Last examination date, that is physical examination last when he was underwent, vision examination, dental or blood examination, and the current medication. Note all prescription and medication from the patient. Family history, the purpose why to learn about the general health of the client's blood relatives, spouse and children, to identify any family history of communicable diseases like smallpox or any cardiac problems, any hereditary factors associated with the cause of some diseases. Strong family history of certain problems, to identify any family history of certain problems, health of family members, whether there is maternal parents or siblings, uncle, aunts have any health issues, cause of death of any family members, that is immediate means our parents, siblings and extended family, our grandparents, uncle, aunt, etc. So this is a genogram or drawing a family tree. So make a list for all family members. So male you have to, or boy you have to make it as a square, female or girl as a circle. The diagonal line is used to show that the person has died. This line is used to show parents who are divorced together. So SB stands for stillbirth, includes number of weeks. So this is an example. So this is the male, female, father and mother. They have 3 children, 2 girls and 1 boy. This is the patient. Okay. About the functional assessment, including activities of daily living. The purpose is to record major current and health related information about the habits, the whether the patient is having alcohol or tobacco, drug, caffeine or smoking, any street drugs, especially for cocaine, painkillers like Vicodin and barbiturates, medications taken regularly by doctor or self-prescription. Sometimes the patient may take the medication as by the own for sleeping or some other purposes. Activity, whether the patient is having an exercise regular pattern, whether the patient is in a life pattern is sedentary or active. Sleep and rest, sleep pattern, daily routine, when he will sleep, whether there is a proper timing, daily daytime naps, any drugs used for sleeping. Nutritional history, you have to ask the diet, whether the patient is vegetarian or non-vegetarian, number of meals per day, what is the food preference of the patient, how many glasses of fluid he will drink each day, tea or coffee, how many cups he will drink, cola or any glass per day. Personal hygiene, coming to the oral hygiene, how many times bath per day. Elimination history, which includes bowel per day, how many times he will, whether he has a regular pattern, constipation, urinary frequency during day and night. Coming to the menstrual history, whether it is regular or irregular, scanty or heavy cycle. Environmental history, which includes the housing, whether it is good, whether it is drinking water facilities available, safety area, access to transport is available, health facility near home, any hazards at workplace or occupational exposure to the hazardous substances. Coming to the sexual and marital history, the spouse, general health, whether it is good, fair or bad, spouse occupation, whether he is working or non-working, whether the relationship is satisfactory or unsatisfactory, whether the spouse is handicapped or any deficiency or any impairment or any implant or any hearing aids or something, you have to write it. Coping and stress management, kinds of stress in life, if there is any stress, what is the method he used to relieve the stress, you have to. So coming to the end of this history collection, first part, and you can check yourself what is the difference between subjective and objective data. So I just have a sentence here. Identify which data is the following statement. Okay, the client's cholesterol level is elevated and the client states he likes fried food, whether it is a subjective data or an objective data. I think you may understand this section. If you like the video, please share, like and subscribe my YouTube channel. The answers you can comment in the comment box. Thank you, and the next part we will discuss about the review of symptoms. Thank you.